next guest. Come on board, Dr. Francis. Come on. Give her a round of applause. Now, she's actually asked.
I'll be okay, okay.
Apparently I'm going
No,
to
I'll
the
be okay.
sofa.
Oh, all
Are
right
you sure?
then. If you're happy to sit there.
All right. I don't think.
I think this is my better side.
I might lie down and have a snooze. Now, most of you seen the TV show that Dr. Francis was in? Yes.
Good.
The question how I wanted to, well, this is quite comfortable actually, is I wanted to start with, you know, you are a GP, you see a lot of people through that door. What happens, and I know you're a little bit different because you tend to trigger a response perhaps before what I'm about to ask you, but when you go to a GP and perhaps they've tried everything and looked at everything, what then? Because I think for a lot of us that, you know, head off to GPs, whether it's with our kids or ourselves, you know, you kind of put in a lot of faith and store in them, and, you know, you're given a script and then you're out the door again. What happens when none of that works?
I think you've got to remember that your GP is really highly trained, and imagine being able to do such a good job in 15 minutes. So really, specialists can't cope with that. So GPs, firstly, are very highly trained. They're very, very knowledgeable. And I think you've always got to trust your GP and use your GP. But sometimes, in a percentage of people, they just don't get better. And I think it's because the GP has only got that limited time and only wants to look at one problem, like your headache, and not your PMT, and not your irritable bowel, and not that you're not sleeping. So what happens when people see me is that I make diagnoses that haven't been made. I know that people's problems are interconnected with each other, which is why I need more time.
Is that the thing though, you're taking more time in that?
That's part
process?
of the thing. I have knowledge that helps me to make these diagnoses and to understand that things are interrelated. I have the clinical ability to make diagnoses when the blood tests are not reliable and stuff like that. And I've got the experience to be able to treat them successfully because it's taken me 10 years to get where I am, you know. So that's what happens, I think.
Is it hard though, you know, if that's your thinking, do you go out on a bit of a limb in that thinking, or is that now the general sort of consensus with GPs, do you think?
It's not the general consensus. Here's an example. A woman in her 60s from up north comes to see me about a problem where she cannot get into a car, or she gets very sick and she can't drink without getting vertigo. And her GP had diagnosed her as having Parkinson's disease. And I went through everything, and she had other things going on as well. And then I corrected her thyroid, and within 3 visits, she was better. And then I looked it up in the scientific literature, hypothyroid and vertigo, and there it was, and I'd never been taught that. So I've come across that quite a lot, and part of what is happening is that hypothyroid is not being diagnosed, and we've got an audience of women here today, and hypothyroid, for a variety of reasons, is becoming more common anyway because we're poisoned and a whole lot of other reasons, but it happens in women, and especially as women age, and it's not being diagnosed because people believe blood tests, which are not reliable. But all GPs know that the test for glandular fever doesn't become positive until 2 weeks after the illness. So we know that if it's negative, you don't necessarily believe that, you go on the symptoms. A lot of GPs know that the vitamin B12 test isn't accurate. But they don't generally know about the thyroid. You see, thyroid was originally a clinical diagnosis. The doctor would listen to what the patient said about their symptoms, would actually examine them, and then discuss with the patient whether, shall we try a bit of thyroid medicine? And it was the old-fashioned medicine, not the one we have now. And then they'd see how they responded. But the problem we have now is that the doctor listens to the patient, looks at the computer and says, no, there's nothing wrong with your thyroid. And I see a lot of that, and I wish I had $1 for every one of those I see. I think that doctors like to make their lives easy. Either that, or the reasoning behind it is we must have a test. You see what I mean? We must have a test for everything so that we know for sure. And generally speaking, everyone's doctor here will tell them that the test is TSH, which is a feedback hormone. It's not the actual hormone. But the problem with that, maybe it used to be reliable, but now we've got so much stress that the TSH gets suppressed by the stress, and now all that stress is draining our zinc. So if we haven't got enough zinc, the TSH will go down, and the doctor will look at it and say, oh no, there's nothing wrong with your thyroid, your TSH is normal. That's the problem we've got. There's an article on thyroid on my website. You could always use that because it explains why the biochemistry is, and you can go online and do a thyroid questionnaire and say to the doctor, I know my test is normal, but could we have a try of some medication? Now, the current medication is T4, synthetic T4, which is the precursor to the active hormone T3. So, depending on how stressed you are, you might not convert much of it to T3. You might convert it over to reverse T3, which blocks the action of active T3. And I've even had patients say to me, when I put my dose up, I got worse. So then if that doesn't work, you say to the doctor, can I try the old-fashioned medicine, whole thyroid, which is a pig thyroid extract, which has got T1, T2, T3 and T4 in it. And we've even got synthetic T3 and synthetic T4. Now, a place that you can go to is pharmaceutical compounding, and I think it's just pharmaceutical.co.nz, but if you just Google pharmaceutical compounding, the people there know which doctors use whole thyroid around the whole country.
So what about in a crisis if you know, you're not really getting results or you're not seeing a turnaround quick enough? What would your advice be in that sort of situation?
When I've corrected all the imbalances and dealt with the network of problems versus deficiencies, and I've got all that right, and someone's not getting better after 2 or 3 visits and we're not moving forward, there's 2 areas that I look at. Breathing, because disordered breathing can cause a lot of biochemical imbalance and keep people tired and anxious and not sleeping and stuff like that, and it's quite common. And the other area I look at is about the way people think about the things that are happening around them. So I'm worried about people that tend to be very, very anxious and can't stop being anxious, and the way they view the world is glass half empty, not glass half full. So I talk to them about how they can think differently, and I talk to them about how they can do it themselves, or they can go and see a psychologist and have cognitive behaviour therapy. A long time ago I had staff that were telling me I was interfering with them being able to do their work. So I learned a lot about recruiting and personalities, and it's turned out to help me a lot in my work. So I know that I'm a powerful with a little bit of perfect and a little bit of popular. But I am relatively balanced and I'm a little bit peaceful. Who's familiar with this? My sister tells me I'm a high D. That's the Myers-Briggs, right? But I'm relatively balanced because I have got some compassion, and I am a bit diplomatic. I sometimes don't know when to keep my mouth shut, but I'm not a doormat. And actually that helps me with my patients, because the patients that have some of the worst problems are the ones that are quite what I call peaceful, the ones that do not want to rock the boat. Their motto is peace at any price. They're sensitive, supportive individuals. They're looking to help people. They have a lot of difficulty saying no. And anyone familiar with that sort of Yeah. And often if it's coupled with people who are really high detail, they really get overloaded because they have to do things really well, and then they can't say no, so then they become overloaded. And I see women who are burnt out like that all the time.
So from your perspective, when you see people come in through the door and they're unwell, Do you look more from a holistic point of view? Do you go
I
beyond
definitely do. The way I sort of think of it as my model, and the model is at the bottom, it's like a triangle. At the bottom it's don't be poisoned, and I don't deal with that straight away because it's very slow, but I do think about mercury, lead, heavy metals, environmental pollutants and things like that, particularly if they're not getting better. But my main focus is going to be making sure people sleep, because that's number one. If you can get people sleeping, their depression gets better, their anxiety gets better.
Can I just ask everyone who sleeps incredibly well, or no, this is a question, who has broken sleep? Look around the room, everyone.
Yeah.
Sleep is a huge, huge thing.
It is huge. Because sleep, I'm researching it at the moment, and it's just incredible. If you don't get enough sleep, you don't have good executive function. That means you can't make good decisions about anything, or in a crisis, you get more depressed. Your immune system's no good. Ladies, you get fat. If you don't sleep enough, you get fat. So that's part of the foundation: sleep, diet, exercise, how people are breathing. Commonly, I diagnosed it 3 times in one day, hyperventilation. So all of that is basic. And then I correct vitamin and mineral imbalances. I would say that 90% of you, anyone here who hasn't had their vitamin D tested, 90% of you are probably vitamin D deficient. So that's something to think about, particularly if you've got darker skin and you've got an indoor job.
But why do you say that? What is happening in their lives that you would say that?
Because we're protecting ourselves from the sun more, and we're indoors more. And we did a survey in our cosmetic, I've got a cosmetic clinic, only because I learnt to use Botox for facial pain, but now I've got a cosmetic clinic. But in that clinic, we test all our patients for vitamin D, and 9 out of 10 of them are deficient. And they come back and they say, I can sleep now, or I'm not depressed anymore, and they came in for something else. And also, it's a high proportion of my chronic illness patients are vitamin D deficient.
So they're not getting enough sun?
Yeah. But if they are getting enough sun, they're not making their own vitamin D, because it's actually not a vitamin, it's a steroid like progesterone that your own body makes. So if you're sick or fat or smoke or on drugs or deficient, you won't make your own vitamin D properly.
I want to go back to the holistic approach to health. And, you know, we talked before about compassion and forgiveness and kind of letting stuff go in your life that can make you physically ill.
Yes.
And that repeated cycle and repeated pattern of being ill because of stuff you haven't let. I want to go
Did you talk about that before?
Oh, you and I. You and I talked about that, remember?
Well, I became interested in this because I had something I couldn't forgive myself, and I'd held it for years and years and years, and I went on a course and I still held it. And then I moved on. And so I read about it because a lot of people have got a problem with the way they think about things. And so when it comes to the fact that you've been hurt by someone, you know how you watch on the television and people come outside of the court and they say, we've forgiven the killer? Do you think they did that because they were Christian or something? You know, they've done it because it was actually eating away at them. And they had to forgive the killer because it was harming them.
I want to take you back to something you said there, that sometimes people don't want to get well. And, you know, we probably all know in our lives, you know, and I mentioned it before, you know, the people that are only happy when it's raining, or the captain bring downs, and, you know, you can have it in your job or your life or whatever. How do you combat those people? How do you not let them come in and... Because if you're a doctor and you know, here's a patient that, you know, it's a regular pattern of coming in for the same sort of thing, or and some of it might just be because they want company. They want to be able to voice that they just want to talk about it. But for you as a doctor, what do you do with that?
Well, I've had a couple of situations that I can think of. When I was a GP and early on in my career, we had an older lady who kept damaging herself and falling over and requiring dressings. And I sort of tweaked to the fact that she lives alone, and I thought maybe she's lonely, and we sort of broached the subject with her, and we got a few things going for her in the community, and that her falling over and requiring dressings was cured. So sometimes coming to the doctor a lot, you know, and I do have patients who come in, when I was a GP, who'd come in about something, but really they were coming about something else.
Frances, thank you very much.
Oh, it's been fun. And I'm available later on. Thank you.
Thanks,